Good day, everyone, and a happy new year to all of you. Okay, so tapos na ang holidays, balik reality na tayo. Okay, so for our first lesson this year, so we have neonatal and pediatric transfusion practices. Actually, parang katuloy lang or kadugtong lang to ng HDFN. Okay, so speaking of HDFN, a little review. So, last topic, we have tackled yung different types of HDFN. Okay? So, we have also this. So, let's look at them naman by their time of onset. So, we have early onset anemia, late hemolytic anemia, and late hyporegenerative anemia. So, or early onset, so that is within 7 days of birth, makikita mo na yung um, signs and symptoms. Okay, for late hemolytic and late hyporegenerative anemia, more than 2 weeks of age pa before natin makita. Okay? So this one is antibody-mediated hemolysis. Okay, this one naman is antibody-mediated din, pero pwede din siyang natural decline ang hemoglobin levels or kaya naman expanding intravascular volume of growing infant. For late hyporegenerative, so this one is antibody destruction of RBC precursors and RBCs. So RBC precursors meaning pati immature RBCs. Okay, so pati immature RBCs apektado. So marrow suppression by intrauterine transfusion and transfusions. So we have erythropoietin deficiency and expanding intravascular volume din. Yun yung makikita natin for late hyporegenerative anemia. So bilirubin levels, this one is elevated for anemia since may hemolysis nga siya. So hemolytic siya in nature. So free hemoglobin will later on turn to bilirubin, di ba? So elevated si bilirubin. Makikita din natin siya sa late hemolytic anemia. But how about sa late hyporegenerative anemia? Normal siya. Why? Normal siya kasi balik ka sa mechanism ni late hyporegenerative anemia. So, pati RBC precursors, damay. Okay? So, hindi na siya nagbigyan ng chance maging RBC. Okay? Sa bone marrow sa bone marrow pa lang, okay, affected na yung si RBC natin. Okay? So, hindi siya normal si bilirubin. Why? Kasi hindi na siya mako-consider as hemolytic anemia. Kasi, decrease na talaga si RBC in the first place. Kasi, again, precursor pa lang, affected na siya. Okay, so, decreased number of red blood cells, decrease din yung red blood cells na nagbe-burst. So, normal nating nakikita si bilirubin. Okay? Yun. Yun yung kanyang presentation. So, reticulocyte count. Reticulocyte is immature RBC or yung the last stage before the mature RBC. Okay? So for early onset, it is either normal or high. High, meaning nagko-compensate si body to produce more and more RBCs, kaya high si reticulocyte count. Same with late hemolytic anemia, pwedeng normal or high siya. For late hyporegenerative, that is low or absent. Low, kasi again, balik tayo kay mechanism niya, precursor pa lang, inaatake na si RBC. Affected na si RBC. Okay, so, hindi na siya nagmamature. Hindi na siya nabibigyan ng chance para mag-mature. Okay? So, wala tayong reticulocyte. Okay? So, low or maybe absent pa nga si reticulocyte count. Okay? Yan. These are the different manifestations ng HDFN-induced anemia. Okay? So, at about 16 to 20 weeks of gestation, so the clinical diagnosis of fetal anemia can be made using an ultrasound technique called fetal middle cerebral artery peak systolic velocity or MCAP-SV. Okay? So the measurement is based on the reduced blood viscosity at lower hematocrites and resulting in faster velocity of the blood. So, ultrasound ang ginagamit ng mga OBs to detect or kaya to monitor if may fetal anemia yung baby. Okay. So, interventions in the form of intrauterine transfusion becomes necessary when one or more of the following conditions exist. So, ito yung mga tinitignan natin para masabi natin, kailangan na natin ng intrauterine transfusion. So, intrauterine transfusion, nasa loob pa lang ng tiyan ni mommy si baby, kailangan na siyang transfusan ng blood. Okay. So, we look at the MSA-PSV, yung kaninang sinabi ko. Okay. If greater than 1.5 ang kanyang value, that indicates anemia. Okay. We can also see fetal high drops. Pag na-note ang fetal high drops sa ultrasound, so that's one criteria. So, chordocentesis blood sample has hemoglobin level less than 10 mg per dl. So, chordocentesis, this one is yung sample na nakukuha natin sa sa intrauterine. Okay, sa intrauterine vein. Umbilical vein pala. Sa umbilical vein. Okay? So, chordocentesis. Amniotic fluid change in optical density results are higher or increasing. So, the amniotic fluid is tested by a spectrophotometric scan optical density at 450 nanometers. So, at 450 nanometers, this is the absorbance of bilirubin. Okay? So, tinetest natin yung absorbance ng bilirubin. So, the measurement is plotted on a graph called the Lilly curve graph. So, according to gestational age. So, an increasing or unchanging value of the result predicts worsening of the hemolysis. So, increasing value ng result or the value na nakuha natin sa testing na absorbance ng bilirubin. So, yun. So, again, bilirubin, okay. Pag increase si hemoglobin will later on turn to bilirubin. So, magkakaroon ng increase in bilirubin. So, magkakaroon ng increase in bilirubin. So, since we are testing for the absorbance of bilirubin, so the higher the bilirubin in the patient or in the blood, okay, so mas mataas yung value kasi mas maraming maa-absorb dun sa light na tinatransmit natin. Okay, so spectrologic lang. Okay, yun. So, the higher the value, so it predicts the worsening of the hemolysis. So, either one or more of these following criteria ang meron si patient, so it is indicates na kailangan na ng intrauterine transfusion. Okay? So, the goal of these transfusions is to maintain the fetal hemoglobin level above 10 grams per dl. Grams per dl. Wait lang. Magkaiba to. Let me check. Sorry that this is supposedly 10 grams per dl. Okay, chordocentesis blood sample has hemoglobin level less than 10 grams. 10 grams per dl to, hindi milligrams. Okay? Okay. So the goal again is to keep the hemoglobin level above 10 grams per dl. Okay? So donor blood, ang ginagamit nating blood for transfusion is usually group O, RHD, negative. Okay? So leukocyte reduced, hemoglobin S negative, CMV safe, irradiate irradiated and antigen negative for maternal red cell antibody or antibodies. So once intrauterine transfusion is initiated, the procedure is typically repeated every 2 to 4 weeks until delivery to suppress fetal hematopoiesis. So the initial intrauterine transfusion is rarely performed after 36 weeks of gestation. So at 36 weeks ng at 36 weeks, rarely na pine-perform si intrauterine or sinisimulan. Okay? Usually earlier than 36 weeks. So intrauterine transfusions are indicated in severe cases of fetal anemia. Okay? This is again performed by inserting a needle into the umbilical vein using a high-resolution sonography as a guide. So same procedure ng chordocentesis. Okay? Sa halip na mag-extract ka, tatransfuse ng blood. Okay? Sa umbilical vein din. So fetal samples may be obtained. So this one is referring to chordocentesis. May be obtained to test for blood type, uh, direct antiglobulin testing, antigen typing, and bilirubin levels. Okay, again, group ORH negative, fresh. Fresh meaning blood is less than 7 days old. Okay? Leukocyte reduced or irradiated and negative for hemoglobin S. Okay, sickling, this one is sickling, red cells are typically used. So in cases which maternal antibody is present, the unit should be antigen negative and cross-match compatible. Yeah. So okay. Intrauterine. The next is neonatal transfusion. Okay. So for neonatal transfusion, pre-transfusion testing may be abbreviated in infants less than 4 months old. Abbreviated meaning shortened. Okay. So for ABO grouping, only forward may be done as antibodies of newborns has not been developed yet at that age. So less than 4 months old, wala pang antibodies. Itong yung mga babies. Okay, hindi pa na-develop pag less than 4 months old. Antibodies start to develop from 4 to 6 months old. So for ABO grouping, pwedeng forward lang gawin. Skip na si reverse. Okay? So either the infant's or mother's plasma may be used for antibody screening and compatibility testing. So if an infant has a negative antibody screen and will only receive group O red cells, repeat testing may be omitted for the remainder of the hospital admission. Meaning, the next time na tatransfusan si baby, pwedeng hindi na tayo mag-test. Provided na group O lang din naman yung itatransfuse sa kanya. So, non-group O red cells may be issued to a non-group O infant provided an antiglobulin test to detect possibly acquired maternal anti-A or anti-B is done. Kapag, kunyari, A si baby and A din yung A blood type si baby and A din yung itatransfuse, okay lang din provided na testing is done. Okay? Antiglobulin testing. So if a clinically significant antibody is identified, so the donor unit selected must be either antigen negative for the corresponding antibody na na-detect natin. So also, kailangan din antiglobulin cross-match, compatible din siya. Until the antibody is no longer detectable in the infant's plasma. Next, we have aliquots. So, aliquots meaning apart from a whole. Diba? Okay? Yun. Same din yung meaning ng alikot sa blood components natin. So, nag-aalikot tayo ng blood, hindi natin ginagamit yung buong blood bag na usually ginagamit sa mga adults. Okay? So, aliquoted blood products are often transfused during the neonatal period or infants younger than 4 months old due to their small blood volume. Okay? So, babies born full term have 75 ml of blood per kilogram of body weight. Okay, 75 ml per kilogram. So, imagine yung baby is about 8 pounds nung pinanganak. Around 270 ml of blood lang ang meron sila sa buong katawan nila. 270 ml. Eh, ang isang blood bag natin is around 400 to 450 ml, right? So, hindi pwedeng yung buong blood bag ang itatransfuse kay baby kasi sobra-sobra naman yun. Okay? So, that is babies born full term pa. So, imagine pag premature ang baby, so less than the said amount pa ang blood nila sa buong katawan. So, that's why we do aliquoting. So, transfusions for neonates are typically dosed at 10 to 15 ml per kilogram lang. Okay? So, therefore, requiring only small volumes of blood products around 10 to 25 ml per dose or per transfusion. So, imagine 10 to 25 ml lang yung kailangan natin per transfusion per baby. Tapos, ang isang blood bag is, again, around 450 ml. Okay? So, sobra yun. Okay? So, anong ginagawa natin? Inaalikot nga natin again. Several alicots may be prepared from a single donor unit. Okay? So, isang blood bag, hindi lang isang beses kukuha ng sample or hindi lang yan para sa isang blood bag, isang baby, isang transfusion. Okay? So, isang blood bag, we can get several alicots for several patients then. Okay? Para hindi naman sayang yung unit. Okay? So, to prepare aliquots of RBCs or platelets, a small container is attached to the finished component using a sterile connection device. So, aliquots of plasma are typically prepared before initially frozen and stored at negative 18 degrees Celsius or below for up to 1 year and then thawed when needed. Also, from a single donor, also we can use that the other aliquoted blood. For example, si baby hindi lang once kailangan transfusan. Okay, so next time na kailangan, we can use the same donor unit na prepare na yung alicot blood. But provided na sterile pa rin siya and closed system yung ginamit natin, pwede pa rin natin yung gamitin. Okay? So it limits the risk na iba-ibang blood bag pa yung pagkukunan natin para i-transfuse. So limit yung risk ng bloodborne diseases and so on. And exposure sa unexpected antigen antibodies. Yeah. So, what are the indications for other indications for small volume transfusions? See, so we include anemia caused by spontaneous fetomaternal or fetoplacental hemorrhage. We have twin transfusion, obstetric accidents, and internal hemorrhage. Yun. Those are incidents na kailangan din nating mag-transfuse. So, blood drawn from infants for laboratory testing in cases of iatrogenic anemia also may result in a neonatal transfusion if more than 10% of the blood volume has been lost due to phlebotomy, which may occur as frequently as every 2 days for infants who require close monitoring due to their fragile clinical condition. Pag monitoring ang blood ni baby, so every 2 days kinukuhanan siya. For example, in some cases, kailangan din na siyang transfusan dahil masyado nang marami yung nakuhang blood sa kanya. So, RBC aliquots is prepared using a closed system. RBC RBC aliquots prepared using a closed system maintain the out date of the original RBC component. Okay? For example, ito yung expiration date ng original, inalikot mo siya using the closed system, ito pa rin yung expiration date niya. Okay? However, if the alikot naman is prepared using an open system, so nabuksan na si blood bag na exposed na sa air, it must be transfused within 24 hours. Yun. I believe sa in Philippine setting, open system kadalasan. Correct me if I'm wrong. Open system kadalasan. Okay, kasi wala tayong usually mga public hospitals wala namang special equipment pa para sa closed system na mag-alikot. Okay, so ang ginagawa nila, tina-time nila or sinasakto nila na para hindi naman masayang yung blood bag, as much as possible, sabay-sabay na transfusan lahat ng bata na kailangan transfusan. Okay? So, para sa isang blood bag, hindi naman masayang kasi 24 hours lang yung buhay niya eh. Yun. Para hindi masayang isang blood bag, so lahat ng need for transfusion, sabay-sabay, sinasabay-sabay nila yung parang schedule para yung alikot or yung blood bag na bubuksan for the alicoting, ma-maximize. Ganun. Okay? So again, within 24 hours lang kasi siya pwedeng i-transfuse. Okay? So, RBC transfusions of 10 ml per kilogram in a unit with a hematocrit level of 80% should raise the hemoglobin level by 3 grams per DL. So, 10 milligram per kilogram na transfuse sa baby should increase or should raise the hemoglobin level by 3 grams per DL. Okay? So, provided na yung hematocrit level is of 80%. If you are wondering why 80% yung hematocrit level ng blood component, that is because PAC RBC na siya. Tanggal na yung plasma, kaya mataas yung hematocrit level. Okay? So, PAC RBC na kasi talaga ang usually tinatransfuse natin. Bihira na lang ang nagtatransfuse ng whole blood. So, as with RBCs, platelet transfusion for neonates requiring only small volumes, several aliquots may be prepared from a single unit with the use of a sterile duct or connected quadruple bag. So this system can increase the number of transfusion an infant can receive from one donor, limiting the number of donor exposures. Or it can be used to supply transfusion to several neonates or infants, providing better utilization of the product during the short dating period. Okay, so ito yung sinasabi ko kanina. So transfusion of platelets and platelet concentrate is indicated for neonates whose count fall below 50,000 per ml and are experiencing bleeding. Okay? So either random or apheresis platelets may be transfused and should increase the platelet count by 50,000 to 100,000 given a dose of 5 ml to 10 ml per kilogram. So 5 to 10 ml per kilogram of platelet concentrate should raise the platelet count of 50 to 100,000 per ml. Okay? So factors that may be associated with thrombocytopenia or yung low platelet count ng neonates include immaturity of the coagulation system, platelet dysfunction, increased platelet destruction, dilution effect secondary to massive transfusion, or exchange transfusion in intraventricular hemorrhage. Sorry. Okay. So how would we prepare platelet aliquots? So this is an example procedure. So select a unit to be aliquoted. So either AB or group specific units should be selected. Either AB. Why AB, not O? Pag red cells, O. Diba? Kasi O ang universal donor for red cells. Universal donor kasi wala siyang antigen. Okay, so even though kahit anong antibody ang meron si patient mo, okay lang kasi wala kang antigen. Now, for platelets, since platelets is incorporated in the plasma, so basically plasma, yung ating um, tinatransfuse. Okay? So, antibody ang titignan natin. Antibody, AB group, anong antibody ang meron si AB? Wala. Okay? Wala siyang antibody. So, kahit kanino mo siya i-transfuse, okay lang kasi wala siyang antibody. Kahit anong antigen na meron pa si patient, ang recipient mo na, ang donor mo naman is walang antibody, so okay lang. Okay? So, kaya si AB ang universal donor naman for plasma. Okay? So, either AB ang gagamitin natin or group specific kung A, edi A, ganun. Okay? CMV negative din, kailangan CMV negative or volume reduced platelets. So, remove cup from stopcock apparatus attached to end of blood set. And then use a 170 to 160 mm filter. This one, I believe, is automated na pang-alikot ng platelets. Okay. So, read nyo na lang to and be familiar na lang. Okay. So, neonatal RBC transfusion, again, dapat less than 7 days old. Less than 7 days old yung blood na pagkukunan natin, na iaalikot natin. Okay, unless infused slowly. And then dapat ORH negative or compatible with mother and infant. Either O negative or kaya group specific. Has to be CMV negative or leukocyte reduced. Hemoglobin S negative for hypoxic newborns. The dose again is 10 milligram per kilogram over 2 to 3 hours. So, red blood cells in CPD na anticoagulant or CPDA1 na additive solution may be used safely for neonatal transfusion. However, recent literature says AS3, which is also an additive solution which contains a higher dose of mannitol, is also safe for neonates. So, blood units less than 7 days old are preferred to reduce the risk of hyperkalemia and to maximize the 2,3-diphosphate glycerate levels. So, hyperkalemia is very uncommon in massive transfusion in adults, okay, but it is of special concern in neonatal transfusion, especially in premature infants. Okay. So, these are the effects ng hyperkalemia or citrate and potassium toxicity from massive transfusion sa neonates. Okay? So, potassium toxicity, hyperkalemia. So, we can see muscular weakness, absent bowel sounds. You have EKG abnormalities, ventricular fibrillation, and then worse is cardiac arrest. Yeah. Kaya we prefer yung less than 7 days old na blood, especially for neonatal transfusion. So for very low birth weight infants, the blood should be selected to be CMV seronegative or leukocyte reduced to prevent CMV infection, which can be serious in premature infants. So pregnant women also if ever they need to be transfused, should be given CMV negative or leukocyte reduced then if they test negative for CMV. Okay. So that's it for our topic this week. Okay. So if ever you have any questions, just feel free to ask your respective advice instructors. Okay. So thank you and have a nice day.